Hi, Dr. Yass here. I'd like to discuss another benefit that you obtain when getting a Yass Method Zoom session. And this pertains to the diagnosis of muscle as the cause of your symptoms. And I'd like to make the discussion evolve around the particular case that I just had. And I think that it will help exemplify why getting a Yass Method Zoom session in terms of getting the proper diagnosis and what that means if that diagnosis is confirmed to be muscular mean to you in terms of resolving your symptoms and returning you to full functional capacity. So this particular person that I recently saw was having symptoms of pain at the left upper trap region all the way into his skull. He would find that if he sat for any sustained period of time at his computer, he would have this horrible pain develop, and he would feel tightness develop, and basically it would make it almost impossible for him to sit for any sustained period of time. And yet his job required him to be at this computer and sitting at this desk for like 8 to 10 hours a day. So this has been going on for a couple of years, and just like you or anybody else, he sought care from the medical establishment and was told he had some herniated discs and some cervical issues. And so he started off in the usual fashion of going for chiropractic and getting adjustments. And he would feel a little bit of relief after the adjustment, but shortly thereafter, the symptoms were right back, and just over a sustained period of time, they progressively worsened. And he also tried some physical therapy with some generic exercises, and that really never had any great benefit whatsoever. So this continues to worsen. The symptoms are getting more extreme. He's having harder and harder times trying to perform his work-related activities by sitting at this computer at this desk. And finally, he was able to find out about the Yass Method and decided to get a Zoom session. So the Yass Method Zoom session always starts with an evaluation. I really think that if you're having pain, if you can't accept and understand this premise that a diagnosis is required before you seek treatment, it basically will fester a situation where you're going to probably be in pain indefinitely. You're basically going to have your symptom forever if you just haphazardly try treatments that people purport to be the answer to resolving your pain. You have to understand that when you get a treatment, what that individual who's providing the treatment is saying to you is that I provide this service and I have no desire to determine upfront what is the tissue in distress that is creating your symptoms. I'm simply out there promoting the idea that I do this treatment, and maybe it works, maybe it doesn't, I don't know, but I'm not going to make an attempt to determine upfront before I provide the treatment what is your tissue in distress creating your symptoms. You must understand that is the idea behind getting treatments. These different types of practitioners that provide treatments without attempting to evaluate you in a diagnostic manner to identify the tissue in distress eliciting your symptoms. So whether it's chiropractic and getting adjustments, whether it's acupuncture and getting needles put in you, whether it's this wacky Egoscue thing where you're doing postures, whether it's doing yoga or awareness for movement or going on a treadmill or doing aquatic therapy or any other type of situation where a treatment is being provided without that individual providing this narrative to you. This is the tissue in distress that is eliciting the symptoms you're experiencing. I know that based on these symptoms, to allow me to know that those symptoms are emanating from the tissue, this identified tissue in distress, and I am going to resolve the distress of that tissue through this intervention. If you don't get that before the treatment is provided, then you are literally spitting on a wall and seeing if it sticks. That's it. That is not a very medical means of attempting to determine what the appropriate direction you should go to resolve your symptoms. You have to accept the idea that whether it's pain or other symptoms, these are part of the body's emergency feedback system. Every tissue in your body has a means. It's been developed through evolution to allow you to know that it is in distress, and each tissue creates a specific symptom with the intent of making the symptoms unique enough so that somebody who interprets symptoms can identify which tissue it is. It doesn't matter if it's bone, muscle, or nerve. It could be organs, it doesn't matter. Every tissue has its own specific group of symptoms, right? So without following that process initially, it literally is almost insane that anybody would be willing to promote a treatment without knowing whether the tissue that is creating your symptoms is the tissue that treatment addresses. I'm lost. I'm lost for words that this is allowed to perpetuate and continues to perpetuate. But being who I am, and that I've developed the Yass Method, which is a diagnostic and treatment model that is based on the very concept by which symptoms are designed to create awareness of tissues in distress. That's what we're looking at when we're doing a Yass Method evaluation through a Yass Method Zoom session. So in this particular guy's case, the pain was only on his left side, from the neck down to the shoulder. And he had started to mention he was also having some shoulder problems had developed. And again, the amazing thing is because the pain was in this upper trap region, it was perceived by the medical establishment to be associated with the cervical spine, when in fact, this muscle right here is called the levator scapula. In Latin, elevate the shoulder blade, which tells you that muscle is associated with shoulder function. Therefore, if you're having pain in the upper trap region, it's most likely associated with muscles that are responsible for shoulder function. It has nothing to do with cervical spine issues. You have to get it through your head. This is science. This is the way the body works. This is an opinion, or it's not some game. Again, it's not treatment with the intent of saying, try it, maybe it works, maybe it doesn't. That's insanity. That's lunacy. So where this guy pain out, think about this. Here's the next question for you. If he had mentioned that the pain he was experiencing in the left upper trap region down to the shoulder were occurring on both sides, would you perceive that as being a different symptom? For the layperson, they would say probably not, because it's the same symptom. It just happens to be on both sides. But by definition, the fact that they are literally different, one side versus two sides, would have to make you begin to think that there are two different types of causes that would cause pain just on one side versus pain on both sides. And this goes back to the way the Yass Method evaluation, developed. It was by having people come in who had pain on one side versus both sides, and recognizing that the causes are different and therefore need to be treated differently. So this is the kind of stuff that seems quite specific to the Yass Method. And again, you're only going to get this through a Yass Method Zoom session if you're not in a position to come to Jacksonville, Florida, and get an in-person session. So once we recognized that he was having his pain associated with dysfunction, his pain was brought on by attempting to sit for some sustained period of time, also with the use of the left shoulder, where he was pressing, he was literally pointing to where he was saying his pain was clearly associated with muscle. He was pointing to muscles. He was saying, this is where my pain is. This is exactly, he's pointing to a muscle. So all of this really was indicative of the fact that he had a muscular cause. The tissue in distress eliciting its symptoms was muscle. I knew this based on the location of the pain, where he was pointing, the fact that it was associated with dysfunction, right? That he couldn't trying to do his activity, sitting would bring on the symptom, right? So once you recognize that it's muscle and that it's not structure, you no longer have to worry about trying to seek care from any medical practitioner, because medical practitioners are not in a position to address muscular causes, right? So now you've cut your number of potential places to go to get yourself fixed down to just a few. So there's the physiatrist who says he can fix you by doing trigger point injections. Well, you have to understand that muscular causes, the idea that a muscle is in distress, creating symptoms, could only relate to the fact that there are force requirements, gravity's pushing down on you, and therefore all your muscles are required to push up against it to perform functional activity. If all the muscles aren't strong enough, they're going to break down. The ones that are weaker have a lesser force output than the force requirement to the activity, and they're going to strain and elicit symptoms. So how does injecting saline solution into the muscle change the force output of the muscle? It doesn't. Again, worthless. It's a treatment. The individual hasn't even identified which particular muscles are creating your symptoms, and yet they're just going to inject you somewhere. So it's basically a treatment. Physical therapy, the usual generic nonsense. And the reason being because physical therapy is a treatment, just as massage. It's a palliative treatment. They say it themselves at the American Physical Therapy Association website. They'll say they are a palliative treatment, which is to say that it is a treatment designed to simply minimize a symptom. It is not designed to identify a cause. And so the average person goes to physical therapy based on a referring physician's diagnosis. The diagnosis is usually obtained through an MRI. So this guy would have gone to physical therapy based on an MRI finding of a herniated disc, stenosis, or arthritis. So the physical therapist is going to treat that person. And so they might give you some generic exercise. But again, it's a treatment, first of all, because they're treating based on the diagnosis of a structural element, which I don't even know what that means. How would doing anything muscular address a structural cause of a symptom? You got to fix the structure, which means surgery. So the idea of having a referring diagnosis of a structural element and then going to somebody who does exercise, again, it's just complete lunacy. It's meaningless, which is why no one ever gets better from it. It's a treatment. I also want you to start to think about this. You're getting treatment for months on end and you're not getting any results. Why? Why would you think that? Start taking a more involved part in your treatment and what happens to you versus just being kind of a follower to whatever the medical practitioner tells you. You need to start being involved more and thinking more for yourself. So you get treatment for months on end and you're getting no better. What does that mean? Well, it can only mean one thing, and that is that the tissue in distress that's being treated is not the tissue in distress. It is simply a tissue that has been identified for whatever the reason, whether it's on an MRI or the person just said it out of the top of their head. Clearly, it is not the tissue in distress eliciting your symptoms. Or you would have resolved the distress of that tissue by now and you wouldn't have the symptoms any longer. Right? So as soon as you're noticing it's 3 months, 6 months, 8 months, 10 months, give up. I don't care if the person tells you it's going to take enough. It doesn't work like that. It should never work like that. If the proper tissue is identified and treated through an intervention that resolves the distress of that tissue, it's like instantaneously you should feel better. Right? I treated this lady in Scotland, 8 weeks of sciatic symptoms. We did one session and she was substantially better. She was able to stand with greater ability. The symptom was greatly reduced. One treatment. Because I knew that sciatica in almost all cases is due to a muscle in the butt, a presentation of symptoms guaranteed it was that. And so all we had to do was strengthen the appropriate muscles to take the need of the piriformis in the butt to strain, thereby stopping it from impinging on the nerve. And therefore she saw the results in a single treatment. Right? That's what you should expect. You get a Yass Method Zoom session, I can tell you now, in the first session to 2 sessions, you had better see a reduction in symptoms, or there is something wrong what's going on, whether it's on my side of trying to evaluate and diagnose the tissue in distress, and if it's muscle, which muscles, or on your side in your ability to perform the muscles accurately, perform the exercises accurately with the appropriate resistance, to eventually have the intent of causing the muscles to achieve a force output which is greater than the force requirement of your activities, which is how you become pain-free and fully functional when the cause of your pain is muscle. So going back to this guy, it's important to understand I was able to establish specifically the muscles that were required to strengthen around the shoulder and shoulder blade so he would have normal function. And these muscles also are involved in helping pull the head back because, as I said, the levator scapula attaches to the shoulder blade and up to the upper cervical region. So if we change the position of the shoulder blade to back and down, by definition, since that muscle is attached to the head, it's going to pull the head back. And so we did these exercises and he felt better. He could already see it to some degree that he was able to hold his head in a better position. He was able to keep his shoulders back. He was able to sit longer without symptom. That wouldn't have happened if he had not gotten a Yass Method Zoom session. The evaluation portion of the session confirming that the cause was muscular, and then determining which specific muscles were responsible for his symptoms and his dysfunction, and then providing the appropriate exercises, which are very specific. Yass Method exercises incorporate a technique that says that since a muscle only moves one joint in one direction, in performing the exercise, you should only be moving one joint in one direction and then applying resistance to cause that muscle to adapt and get stronger. That's the key to the Yass Method in terms of the treatment portion of addressing muscular causes. So we got all this, and there was the benefit. The guy got a Yass Method Zoom session, got a Yass Method evaluation, determined that the cause of his pain was muscle, determined which muscles are involved. Then he got the Yass Method treatment component, which incorporated performing isolated strength training and causing those muscles to adapt through appropriate resistance, since we do these mostly through Zoom sessions, using resistance bands that are secured in a door and allow the person to then create their resistance. The good news for everybody is that these sessions are videotaped. Therefore, you use that going forward to make sure that you're doing everything correctly. And you get 4-week follow-up sessions to make sure that everything is going exactly as it should, that you are performing the exercise as accurately as possible and utilizing the appropriate resistance to get your results in the shortest period of time. So that's what I want you to understand about a Yass Method Zoom session. This is another benefit. There are multiple reasons why a Yass Method Zoom session is the only true way you're ever going to get the right diagnosis and the right treatment to allow you to resolve your symptoms and become fully functional in the shortest period of time. This is one of them. Getting a muscular cause established, and in doing so, understanding which muscles have to be addressed and having the right understanding to achieve that goal. So just to complete this video, if this is starting to make sense to you, you want to get in touch with me directly, in the description, I'll have my email address, which is drmitch@mitchellyass.com. If you've decided that this sounds right to you and you want to schedule an appointment, you can go to my website, which is livewithoutpains.com/sessions, livewithoutpains.com/sessions. And there'll be a scheduler there. You can select the day and time that's most comfortable for you, and we will perform the session with you. If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I am live on YouTube. So let's just reinforce this point. You will probably never, ever see your symptoms resolve or achieve a full functional capacity until you get the right diagnosis. Stop thinking that getting arbitrary treatments is the answer. You're going to get tired of spitting on the wall. It's probably going to come back and hit you back in the face. Get the right diagnosis, get the right treatment, get it through a Yass Method Zoom session. All right? For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.